Okay, so let's unpack this situation. Picture this. You've got a loved one in the hospital, and there's just this whirlwind of emotions, right? Hope, worry, maybe just plain confusion.
Hmm.
You really, really want to know what's going on. How did the surgery go? What did the scans actually show? What's the plan for, today?
It's completely natural, a basic human need in that moment.
Totally. But then trying to get that info in a super busy hospital without feeling like, hey, am I bothering them? Am I asking too many questions? It can feel like you're trying to solve a maze.
Yeah, it really does. And it just adds another layer of stress, doesn't it?
Right.
On top of everything else you're dealing with.
Exactly. And you need that information, not just for your own peace of mind, but like being informed helps you actually support your family member better. Be a proper advocate.
That's the key, being an advocate or partner in their care.
Right. So our mission for this deep dive is to kind of arm you with some knowledge. We've looked at a bunch of sources, stuff from big healthcare quality bodies like Joint Commission International, NABH in India.
The accreditation side.
Yeah, and also insights from a healthcare consultancy about how hospitals actually put these standards into practice. Plus some really practical guides on, how to actually talk to staff.
So we're covering it from different angles.
We are. The goal is to give you a really clear picture, how to get those daily medical updates, what you should be listening for, and maybe understand a bit about how this all fits into the hospital's own drive for quality and safety.
Okay, so let's start with the absolute basics, the why. Why are these daily updates so important when someone's in the hospital? Our sources are pretty clear on this.
Yeah, they really hammer it home. I mean, the most obvious reason is just staying in the loop clinically. Things can change fast in a hospital.
Super fast. A treatment plan might seem set, but then the patient responds differently or a test result comes back.
Right. So you need to know about those adjustments, right? Is the medicine working? What are they planning next? It's crucial just to keep up.
Absolutely. And it goes beyond just the medical facts. Actively seeking and getting updates actually helps build trust.
How so?
Well, it shows the medical team you're engaged, you're involved, you want to be a partner. And that encourages them to be more open with you. It helps build that bridge of trust that some of the guides mention.
Ah, okay. That makes a lot of sense. It shifts the dynamic. You're not just a worried visitor pacing the hall. You're part of the team, in a way.
Exactly. And being part of that team means you might spot things earlier.
Like potential concerns.
Yeah. If you're getting regular updates and something doesn't quite match what you're seeing or you just have a gut feeling,
Yeah.
being informed gives you the confidence and the specific information to ask targeted questions.
Okay, so it empowers you to participate more effectively, make better decisions maybe, offer support more confidently.
Precisely. It's about that partnership. Now, speaking of the hospital team, they're complex places, lots of different roles.
Right. Who do you actually talk to? Getting reliable info seems to depend on asking the right person.
It really does. The sources break this down quite well. The who's who of hospital communication.
Okay, let's get into that. Based on the guidance, who's the go-to for the main medical updates?
So for the big picture stuff, the diagnosis, the major treatment decisions, the overall plan, you really want to connect with a treating doctor, sometimes called the consultant.
They're the main decision maker.
Correct. They usually do rounds on their patients, maybe once or twice a day. That's often your best window for a more detailed discussion about the strategy.
Got it. The consultant for the strategy. But they're not always around, right? What about more frequent updates or outside those round times?
That's where the duty doctors or resident doctors come in. They're the ones physically present on the ward or in the ICU, pretty much round the clock.
Okay. And what can they tell you?
They can usually give you more immediate, sort of brief updates, maybe after a test result is back or if there's been a change in medication overnight. But they might not be the ones to discuss major shifts in the overall plan. That's usually the consultant's role.
Okay, so consultant for the big strategy talks, duty docs for the day-to-day clinical changes and quick questions. What about the nurses? They seem to see the patient the most.
Absolutely. The nursing staff are vital for that minute-to-minute picture. They know the patient's current condition, their vital signs right now, when meds were given, the details of their daily care.
So they can give status updates.
Yes, status updates on those practical things. But, and this is an important point the sources make, nurses are generally not authorized to discuss the diagnosis or give a prognosis. That's medical assessment.
Okay. Stick to the nurses for how things are right now, practical care details. But for the why and what's next, medically speaking, that's the doctors.
Exactly. Knowing who holds what type of information helps you ask more effectively. Get verified details. Avoid frustration on both sides.
That distinction is really helpful. Okay, so we know who to ask. Now, the guides also had a lot to say about how and when to approach them. This feels like the really tricky part.
It can be, but there are practical tips. The sources really stress being, well, clear and polite. Seems obvious, but it matters.
Yeah, simple language like, could I please get an update on my father's condition today? Something specific.
Exactly. Courtesy goes a long way, and timing. Timing is absolutely key.
When's the best time then?
Generally, try to catch them when they might actually have a moment. Often during or just after the doctor's rounds, frequently early morning. For ICU patients, there are often specific scheduled times for family updates.
Okay, respect those scheduled times if they exist. It's probably part of their quality process anyway.
Very likely. It ensures consistency.
And what about times to definitely avoid asking, unless it's a real emergency?
Yeah, the guides are clear here. Try to avoid really busy periods. Shift changes are a big one staff for handing over critical information.
Makes sense. Don't interrupt the handoff.
Right. Also, medicine rounds, when they're focused on distributing medications accurately, or obviously if they're dealing with an emergency situation unfolding, use your judgment, but err on the side of caution during those peak times.
Be mindful of their workflow. That's smart. Another tip I saw was about preparing focused questions.
Yes, instead of just, how's he doing, which is vague, try asking something specific. How did the results of that blood test look? Or have his vital signs changed much since yesterday? Or what's the next step after this scan?
Focused questions get focused answers, presumably faster.
Exactly. Helps the team give you relevant info quickly. And related to that, the sources strongly suggest designating one family member as the main point person for updates.
Oh, that's a big one. Avoids the whole team having to repeat the same update 5 times.
Precisely. And it cuts down on potential miscommunication if different family members hear slightly different things. Keep it streamlined.
Super practical. And for that designated person keeping some kind of log, that sounded really useful.
Yeah, just a simple notebook, or even notes on your phone. Jot down symptoms you notice, the names of tests and dates, medications, what the team said the next steps were.
It helped you keep track, remember things, and then formulate those focused questions for the next update.
Think of it as your personal cheat sheet for your loved one's care. And don't be afraid to ask if the hospital provides any written information summaries, forms, detailing the plan. Sometimes they do.
Okay, so those are the do's. The guides also mention some don'ts, things that can actually get in the way of good communication or even disrupt care.
Right. They warn against things like crowding around the nurse's station constantly.
Impeding traffic flow, basically.
Yeah. Or demanding instant answers when staff are clearly swamped. Also, trying to record conversations without asking permission, you need to check the hospital's policy on that first.
Good point. What else?
Questioning every single medication dose without a specific reason or concern. It's okay to ask for clarification calmly if you're unsure, but constant questioning can undermine trust.
And definitely, please don't ask the cleaning staff or, the person delivering food trays for medical updates.
Stick to the clinical team. That's rule number 1 for getting accurate info.
Okay, so you've navigated the who, when, and how. You finally get that update from the doctor. What kind of information should you actually expect to hear? What are the key things to listen for?
The sources suggest doctors will typically cover a few core areas in a daily update.
Okay, like what?
They'll likely start with the basics, vital signs and health stats. Blood pressure, heart rate, temperature, oxygen levels. Gives a baseline of stability.
The core numbers. Got it.
Then they'll talk about the response to treatment. Is the patient getting better, staying the same, getting worse? Are the current treatments working like they hoped? Do things need adjusting?
Makes sense. Are we on the right track?
Exactly. They should also cover test results and progress. Explain what recent blood work, scans, or other tests showed, and what those results mean for the patient's condition.
Context is key there, not just the raw result.
Absolutely. And crucially, they should outline the expected next steps. What's the plan moving forward? Any procedures coming up? New therapies? Are they starting to think about discharge? And what might that timeline look like?
The forward-looking piece?
Right. And they should also mention any potential complications or concerns they're keeping an eye on.
Okay, having that kind of structure, vitals, response, tests, next steps, concerns, helps you process it all and really understand where things stand.
It does. It gives you a framework.
Now let's zoom out a bit. We've talked about the how-to for families, but why do hospitals even have these systems? The schedule updates, the specific roles. It's not just random, is it? It often connects to this bigger picture of healthcare quality and safety.
Exactly right. Hospitals, especially those really focused on excellence, often implement these structured communication processes as part of achieving and maintaining quality standards. This is where organizations like Joint Commission International, or JCI, come in.
JCI, they're a big name globally, right? Setting standards for hospitals.
Yes, a major international body. They set rigorous standards for healthcare quality and patient safety, and they work with hospitals in over 70 countries. Achieving JCI accreditation is a significant mark of quality.
And good communication is part of that.
Definitely. Their standards often include things like the International Patient Safety Goals. Clear, effective communication between staff and with patients and families is fundamental to achieving many of those safety goals. It's about building reliable systems.
And you mentioned NABH for India?
Right. The National Accreditation Board for Hospitals and Healthcare Providers, NABH, plays a similar role within India, setting national benchmarks for quality care and accrediting hospitals. It's part of the Quality Council of India.
So getting accredited by JCI or NABH isn't easy. It requires hospitals to really get their processes in order.
This huge undertaking. It means putting detailed quality management systems and standard operating procedures, SOPs, in place for almost everything they do. And that's where consultancies, like Supreme Medic Consultancy mentioned in our sources, can come in.
They help hospitals navigate that accreditation process.
Exactly. They help hospitals plan, implement quality systems, train staff, and basically get ready to meet those demanding NABH or other accreditation standards.
Okay, so when you as a family member encounter a hospital that does have clear communication protocols like scheduled update times or a designated doctor for family talks, it's often not just nice to have. It might actually be a result of them working towards or maintaining these quality accreditations.
That's the connection. These standards essentially require hospitals to build reliable processes, and effective communication is a core part of delivering that highly reliable care JCI talks about. It's baked into the quality framework.
That really reframes it. It's not just about making families feel better. It's tied directly to patient safety and overall care quality. The sources mentioned accreditation leading to increased confidence and a stronger safety culture.
Which inherently involves better communication. Understanding this system can actually empower you as a family member. It helps you see that you have certain rights within this system.
Rights, like what?
Well, the right to clear, timely information. Our sources mention this explicitly. Information about the diagnosis, the treatment plan, the likely outcome or prognosis, the risks involved, the options available, even the potential costs.
That's not asking for a favor, then. It's part of what quality care should include.
Correct. And it includes the right to request things like written summaries, details about discharge planning, or copies of medical reports if you need them for insurance purposes, or maybe for getting a second opinion.
It puts you more in the position of being a partner in care, not just a passive recipient.
Exactly.
Yeah.
And the sources emphasize that when families approach communication respectfully and in a disciplined way, using those tips we discussed, it helps build those bridges of trust with the medical team. It's a two-way street.
Which brings us back nicely to being considerate of the staff's time.
Yes. Being prepared with your questions, knowing who to ask, choosing the right moment. It's not just about being polite. It's about making the communication efficient and effective for everyone, while still ensuring you get the information you need and have a right to.
Finding that balance. Assertive about your need for information, but respectful of the environment.
Patience and understanding really go a long way in these interactions. It's a stressful time for everyone involved.
Okay, so let's try and tie this all together. Getting effective medical updates in a hospital seems to be this blend of things. It's knowing the practical stuff, who to ask, when, how.
Right, the tactics.
But also understanding the bigger picture. Recognizing that clear communication is often part of the hospital's own commitment to quality and safety, driven by standards from bodies like JCI or NABH.
And knowing that your respectful, informed participation actually helps the whole system work better. It makes you a more effective partner.
Being proactive, prepared, it really can make a difference in how well you can support your loved one and maybe reduce some of that anxiety.
Definitely. It gives you a greater sense of control and confidence during a difficult time.
So, thinking about all this, here's a final thought maybe for you to consider. How might understanding that these hospital communication structures are often linked to these high level external quality standards, how might that knowledge actually empower you as a family member to be a more confident and effective advocate, a true partner throughout your loved one's hospital stay?